a world already. Sorry, it's a big sign here. All right, sorry about that. So again, as you can see, this is a worldwide issue. Many people across the globe are suffering because of this current pandemic. So what can we do as a community to help relieve some of our anxiety? We definitely need to learn from our past and apply some of those lessons. We've gone through pandemics before. We've gone through the 1918 influenza, where it affected millions and millions and millions of people across the globe. And we actually learned quite a bit from that. That's where we actually today got our social distancing policies. That's actually how we got today our using of the mask, which actually came a little later. But we did have some of those things in the past. We also had shutdowns and lockdowns and isolations back in that time frame, which we are using at this time. Problem is that we all have to continue to agree to all of these social adjustments to limit the spread. We all, as a whole, as a community, need to understand that these things are really, really critical and crucial to limiting the spread of this current disease. Limiting the spread of these diseases will also help lower our anxieties. We have to also understand the use of our modern equipment and our PPE. We have to understand that the mask, as even though the CDC in the beginning didn't say it was very useful, all those current studies now show that the mask is extremely helpful, up to 60% possible, where it can help you prevent the spread of the disease, which is a lot. So please understand that and the proper use of PPE. We'll talk about PPE in a little bit. We also have to maintain our hygiene. That's a constant now, where we have to wash our hands for at least 20 seconds as often as possible when you've touched or gone through public spaces, to definitely wash your hands and hygiene and prevent yourself from touching your eyes and your orifices at that time. We also have to apply surveillance strategies to the proper use of tests. Right now, the UHMC College actually has a really good surveillance system in place where a student or a faculty or someone, anytime they enter in a particular part of the building, you should be using that survey to check yourself in. That way we can track to see if once a person has possible COVID, we can look back to see where that person was on our campus. It's really, really important to be able to apply these surveillance strategies so that we can limit the areas that the person was, and also at that point in time, we can start to isolate and quarantine certain people that they were in contact with. That's very difficult to do if we don't have a track or a trace of where they've been for the past 48 hours or more. So please utilize those things that we have now on our campus when you go from building to building or class to class, that we are making sure that all our students, faculty, and staff are applying and using these tools and strategies to help limit the spread of our COVID for our campus. We understand also that the public health consequence, and we have to look at and limit all these impacts when it comes to child trafficking, when it comes to suicide, the mental health issues. We all have to really look at all of that as well, and to see how we can really help limit the impact of all of those things for our students here. We have students now who have high levels of anxiety and depression, but they can't come onto campus because the campus is closed. Things like that, we need to really look at and see how we can really help adjust and how we can move forward with that adjustment. And of course, towards the end of this, we got to look at how we can continue to move forward, how we can finally reopen fully as a community statewide. So currently, what are we doing right now to help address some of these anxieties? What is our current response throughout the state? Right. Currently, we're using these 4 different things that we're social. 3 different things. We're social distancing. We're going to quarantine when someone is possibly affected or infected, and then of course we're going to isolate. And what does that actually look like? Some people. So we're going to look at that. Right. As of yesterday, and there were 25 new cases statewide. 4 on Maui. As of noon today, there will be another new number, but which you can get later and see what that number. We've averaged in the mid-20s for the past week. Prior to that, we actually were averaging in the 40s. So we had what we would consider a second bump in our community, which also was actually expected because of slowly reopening our community into whether it's outdoor activities, whether it's group gatherings. They were saying this second spike, so to speak, possibly could have come from the 4th of July weekend, where there's a lot of people that were congregating and joining and getting into parties. So as of today, there's been 1,418 cases of COVID-19. 11% have required hospitalization, and about 1,300 or 92% of those were all residents. And according to the current statistics, 7.7% of our entire population has taken a COVID-19 test. Out of that, 1.3% of our population have actually tested positive, and we currently have 24 total deaths statewide, which is the lowest in the nation. So the reality according to our numbers and statistics is that Hawaii has done a tremendous job of limiting the spread of the COVID, the deaths of the COVID. We've done an extraordinary job when we came to shutting down the airlines and all of that stuff. Of course, it came with a price for the economy, but we've done an amazing job, right? So when it comes to social distancing, also known as physical distancing, the things to look at is doing your best to not gather in large groups. You always must try your best to maintain minimum of 6 feet distance. But however, we know right now, the actual distance what we should be trying to keep apart is anywhere between 10 to 12. And actually, the farther, the better, right? You want to try to stay out of crowded places and avoid mass gatherings. And of course, you always want to have your mask in public. This is currently what I just got today from the CDC. The current coronavirus fatality rate. As you can see here, it lists the ages from 1 to 4 all the way to 85 and above. And as you may have already known, the older you get, the more prone you are to being affected, highly, highly affected by this current disease. The younger you are, you're not as susceptible. You can still catch it, but the chances of you dying is very, very small. So that's just an example as far as what's currently going on. As of June, these numbers have stayed very, very, very static and similar. This is another look at it of a breakdown. For example, from anyone at the age of 5 to 15, as of May all the way till as of July 18th, we had only a very relatively, from age 5 to 14, we have less than 12 deaths country throughout the United States. So it doesn't, as the saying has gone study-wise, it hasn't affected our young as nowhere near as it has as far as mortality rate as anyone older. The older you get, the more susceptible you are. And of course, if there's comorbid issues where you have underlying issues, that's another big factor in the causes of death for these individuals. So, that's just a snippet of the picture as far as for a lot of us who have children and worry that our children are going to catch it, the worry that they may get really, really sick and require hospitalization. As of yesterday, Dr. Josh Green, Lieutenant Governor, mentioned that our state capacity for our ICU beds and hospitalization beds are still very, very high. We're not using that much of it as of right now, so we still have a large capacity if we do have a huge spike in cases. Hopefully we don't. So what can we do, right? We have to continue social distancing. We have to continue all of these things. For all these businesses, they have to continue managing, the 6 feet distance in their businesses. They also have to always, as far as gatherings, indoors and outdoors. Indoor gatherings, you can only have up to 50 people indoor, but at that 50 people, they also have to be separated to a minimum of 10 per grouping. And same thing for outdoor gatherings, a minimum of 100 people. And those 100 people also have to be groupings within 10. So as of right now, organized sports, they still have kind of limited some of those things. You're allowed to play basketball, football. They're starting to come into rounds with allowing some football and flag football starting to come around as well. As far as exercise is concerned, you definitely can exercise. Gyms are now open, with some gyms on the wall starting to having to be closed because of contamination. So it is really important with the social distancing in all areas and aspects of your life when you're outside of your home to maintain this, in the businesses, in the stores, wherever that you are. This is quote unquote our norm that we have to do right now to limit our anxiety, to limit the chances of getting the COVID-19. So these are things that we have full control over, so we have to continue to maintain. Our educational setting, which is a big hotspot right now. Currently, the HSTA has put in a movement or a suit against the state to hold to see if they can delay the opening of school, which is supposed to be on August 4th. I know my kids start on August 6th. So we talk a little bit about that, right? With the educational social distancing, the DOE has put out a bunch of their guidelines regarding the different multi-track schools, the difference with their distance education and learning, and the assessment for learning, and also the opening of their programs. It's all on the Department of Health website, and some of the things that they're going to do. Is it a risk? Yes, I think it is a risk. However, a lot of our kids right now and a lot of our parents will be struggling with that balancing with the opening of the economy. Can we maintain our anxiety and continue to feel and be afraid of it? It's going to be a detriment to ourselves, to our children as we move forward if we don't move slowly forward. And can we paint the perfect picture on how we can address all of these anxious moments as far as our kids? No, we can't. We can't. We can do the best that we can, and we adjust fire as we go, and we modify as we go, which I think with the DOE, they're trying their best to address. They still have to ensure that every a child has received 80 days of instruction. They're going to prioritize kindergarten and second grade, kindergarten to second grade. They're also going to look at the vulnerable populations, the special ed students, the students with disabilities, the English learners, students who are economically disadvantaged, students who don't have the means to feed, to eat, to have a meal throughout the day, students who don't have laptops, who don't have Wi-Fi that they can get to get distance learning. So the educational system has looked at all of these things. And so they're really pushing hard to address as many of them as they can. Is it a perfect system? Absolutely not. Will there ever be a perfect system? Maybe as we progress through this, we can. But this is the first step, and it's a step in the right direction, considering our numbers, considering what we have here in the state of Hawaii. I think the governor's thought to delay the opening of the state to the tourists to September was a good choice. As we try to address the issues with their children. But remember, even as our children do go back to school or wherever that is, whether it's school or not, if we apply the same principles with the social distancing, with the proper PPE, we will do what we can to control the spread of this disease in itself, right? We can make all these recommendations. We can, the DOE, the State Department of Health can all put these, and the CDC can put all these recommendations. But if we don't do our part, we're still gonna create the widespread of this disease and continue to increase our anxiety about it, continue to increase our vulnerabilities about it. So we have to all work together with these things. As far as the educational setting is concerned, there's a lot of schools, they have they have multi-track schools. Like for example, my children going to Kinke, Kaulike, and Kalama, they will stagger the children, so 50% of the population will be on campus at the same time. And they're also looking at as far as grouping the children so that whatever group that you're in, that's the group that you move with, so that again, it limits the contact, it limits the spread. So for example, if there's a kid that does test positive for COVID, then they can isolate quicker, and the spread of that to other students will be also limited, which is actually the best thing you can do regarding surveillance practices. So these are things that we can do to help with that, to help address our anxieties about sending our kids back to school. And hopefully that graph I showed you as far as the fatality rate or with our children is very, very, very low. Is it possible? Of course, there's always that possibility. But when we look at data and the research of it, it's very small probability. That in itself can hopefully help us as a community, as parents, to feel a little bit more at ease, knowing that our kids going back into these settings will be safe as best as we can. Now we'll talk a little bit about what happens when they come home to the family as well. So the other part is the quarantine is still required to quarantine from out of state. They have to maintain a 14-day quarantine. Also, if they break that quarantine, there's repercussions to those quarantines. And this is some of those repercussions, up to a $5,000 fine and jail time. Of course, isolation, if you do get contracted or you confirm case, you definitely need to isolate as best as possible, where that person needs to have their own separate everything, either separate rooms, separate bathrooms, separate area. They have to be away from the family members as much as possible. So Now, coming to question, when kids come home from school, you're going to have that thought that, oh, this kid had contact with other kids, but the Department of Education has tried to limit the contact of these kids with other kids, meaning there will be with their own select group of kids as they move around through campus. However, there's still always that possibility, but when that possibly happens and that student comes and there's a student is notified that they've been the school is notified that someone's tested positive, they will do contact tracing immediately, and as a parent you will be notified that there was a student in class that was possibly infected with COVID-19. So the Department of Health has a lot of things in place when it comes to these things, so you'll be notified immediately or very, very quickly as soon as there's a notification of a positive case. So this is the one I was talking about earlier, the guidance for large and extended homes, right? The part that we can for ourselves, as we have a lot of us have extended families where we have grandma, grandpa living with us, or we have an older auntie or uncle living with us. So these are things that we can continue to do, right? We want to also limit our errands. Now, our kids going back to school is one thing, but we as ourselves also go out into the community. So we still have to maintain our social distancing when we go out into the community. We also have to maintain and also limit our errands as much as possible. We also still have to maintain our washing and hygiene. And of course, physical distances wherever we can. We also want to constantly clean and disinfect frequently touched areas of our home, just as we would in a public setting or in a community setting or in our classroom setting. That still has to be happening in our home. If we cough and sneeze, we should always do our best to cough into our sleeve, not into our hands, because our hands is what we touch into. And of course, washing your hands shortly after. If someone becomes sick at home, we need to isolate or quarantine that person as soon as possible until we can have a definitive answer whether that person may just have a foodborne illness, flu, and nothing, and hopefully not the coronavirus. And of course, you want to limit visitors in your home, not have large gatherings in your home, not have large birthday parties. These are things that we need to do in our homes, all right, that can protect us as well. Sending our kids to school, the DOE, Department of Health, will do what we can. They will do what they can to spread spread the virus, the disease in that end. But we as a family still need to do our part as well. We can't just say kids are going to school and they will bring something back. There is a possibility, but they're taking precautions. We as a family, as a household, we still have to have our precautions as well. And that's just as important as what the DOE and Department of Health as the precautions are taking there. Is it a fail-safe process? No, absolutely not. Are we ever going to have numbers increase when children go back to school? Yes, there's always that possibility. Should we hide from it? We cannot. Unfortunately, we cannot keep hiding from this. This disease will be around for a long time until a vaccine will come out, which we'll talk a little bit about. This disease will be here forever. COVID-2 will be here forever until, it's basically like what we said earlier, what you may have already known, it's like the common cold. Until we can get vaccination, until we can get herd immunity, which is where we as a community is very, very, very far off. We won't be getting that anytime soon. It might take us 20, 30 years before we actually get herd immunity. So the vaccine right now is our only hope and saving grace. And the things that we do as a family, that we do as an individual with the social distancing, proper use of PPE, those are things that can really help us. And if we remember these things, we can really try to move forward in a normalized state as best as possible. I talked about PPE before. We're going to just slide through these things real quickly, right? PPE is basically any kind of cloth, mask, things like that. For our public, for our doctors and nurses, they have more rigorous forms of PPE. Of course, with PPE, we want to be, the biggest thing is to have constantly washing our hands, and social distancing is extremely effective in limiting the spread of these things. Proper the cloth mask or homemade mask is critical and crucial, as we've been discovering now through more research. With the cloth mask, it can provide up to 60% of protection, however, that cloth mask needs to be more than single layered. It has to be multi-layered cloth mask. The more layers, the better. Even if you put a filter between the layers, that's actually really, really important. So, because it's going to really help limit the aerosols that may come through. A singular cloth mask will help prevent the larger droplets that COVID could possibly in. But with a multi-layer mask, it will be very, very effective, or quite effective, in limiting the aerosols that also come out from a cough, from a sneeze, from a yell, things like that. So that's really, really important right now, to utilize your cloth mask whenever you're out in public. This is one we put out where the people wondering, oh, should I be wearing gloves? The reality of gloves don't really help at all, unless you're in a professional setting where you're in contact with someone COVID positive. But even those, the gloves are immediately taken off and replaced regularly. When you're out in public, it's not really a requirement that you have gloves to touch things, as long as whatever it is that you touch, you wash your hands immediately after, or you use some kind of antibacterial disinfectant on your hands, and you'll be fine. The gloves is not necessary. Where should you wear gloves? Excuse me, mask. You should, and where should you not? Right? When you're driving in your car, you don't need a mask. You're the only one. If you're in a car with someone from your family household, no one in the household or in that car needs to wear a mask. If you're at home, you don't need to wear your mask. If you're outdoors exercising, you should not need a mask. Right? However, if you are exercising indoors, you definitely should wear a mask. These are really important, and a lot of people are anxious about going to gyms. And right now, unfortunately, it's a difficult. I wouldn't recommend going to gyms at this time unless the gym has taken particular steps to isolate people and have specific quadrants or areas for you to be able to exercise on your own. Due to the fact that when you're exercising, your breathing becomes a lot heavier. And in which case your breath can aerosolize the virus, and it can spread it much, much easier and harder that way, because you're breathing harder during your workouts. So and if you do work out, it's highly, highly, highly recommended that you wear a mask. We talked a little bit about that. Again, wearing masks we've been beating that with a dead horse. It's really critical and important that we all wear it to the best of our ability. This is one we put in on here because some people are asking about children and people who have younger children. It's not recommended. CDC doesn't recommend that a child under the age of 2 be wearing a mask. And of course, for anyone else who has trouble breathing or has a health condition where a mask would not be good for them. Anyone over the age of 2 is more than appropriate for them to wear a mask, and it can help protect and limit the spread again in that sense. I'm gonna just go over this. Just remember that recommended cleaning is really important. You should be disinfecting everything that's highly touched. And you should also yourself should be, if you come into areas that's a common area, you should be wearing some sort of PPE gear yourself, whether it's a mask, gloves, disposable gloves, and you're cleaning the items properly with the correct disinfected tools. This is just a quick one, which I won't go over this very much, how long the coronavirus stays on surfaces. It can stay on surfaces for quite a while, for hours up to days. So just keep that in mind. Who should be? We'll go over that. If you know of someone who doesn't have a doctor or a PCP, these are some areas in the community that you can. On Maui, there's Minute Medical, Mālama Ikeola, Maui Medical Group. They offer testing. Like right now, today, there's a COVID testing going on in Keapulani Park. My medics are there right now doing the COVID testing and blood draws for antibody testing. Also, you can get it in Lanai and Molokai as well. Currently, people talk about the current trials, right? Currently, right now, we're going into phase 3 of the vaccine trial. There's about 4 different major companies is going through it. Moderna is but just remember, normally, to get a vaccine out, it can take anywhere between 6 to 10 years, up to 15 to 20 years, depending on the type. And this particular coronavirus has been around for decades, and we still haven't come across a vaccine for this one. So just keep in mind, right now, the outlook is that the vaccines, they're saying that we could have one by end of year. Realistically, will that happen? That would be great if it did, but the reality is may not. So we can't always bank on the fact that we will have a vaccine at the end of the year or even sometime early next year. Because like I said, normally it can take up to 10 to 15 years to complete the full clinical trials of a vaccine. Right now, the government is trying to expedite it as best as they can, which is great, but there's always that risk of these things not working the CDC guidelines that the vaccine can be at least 50% sufficient is great, but 50% is better than nothing. Again, we shouldn't try to bank on this. We should definitely look and continue what we can control regarding hygiene, regarding use of the mask, PPE, and of course, social distancing. These are things that we can do that will help drastically reduce the spread of COVID-19 in our own livelihoods, in our own lives. This is one of the manufacturers, Moderna. They're trying to fast track the vaccine again. Hopefully it can be out soon. So real quick, when we talk about anxiety, we talk about the economic results that's happening, right? A lot of people don't have the financial support or backing to maintain their daily livelihood. The $600 stipend, or not stipend, that the government is giving for unemployment ends the ending of this month, right around the next week. So there's increased anxiety for people that they may not have money to feed their families, to maintain their rent and whatnot. You know, a lot of companies that you've already seen are shutting down. The Kitchen said they were supposed to shut down this week. They're trying to extend another week. There's so many mom and pop stores that are shutting down because we don't have the number of people in our community going out and spending money, and the tourists, of course, is not there. So this is such a huge anxious moment for our economy. But if we try to balance it as best as we can, which we're trying to, as we open our economy slowly, we're gonna take steps to hopefully help a lot of these hurting families and a lot of these hurting businesses. And a lot of that is we have to get past our anxieties about it, our fears about it. So that's one of the things we got to really look at. This is just an example I want to show you. As of June of this past year, we look at that blue line that's low on the bottom there, and that yellow, that purple line at the top. The purple line was something that happened from 2019, same time as last year. You'd notice that our state has done a tremendous job with limiting the impact of people coming to our islands. We still have people, there's still, most of our COVID-19 right now spread is from community spread, no longer from travel. We've done a good job with that, but this in itself has taken a drastic effect on our community. Well, we're talking about thousands and thousands and thousands of people drastically affected financially, thousands of businesses drastically affected, and thousands of workers drastically affected because now we don't have this the influx of tourists into our community. Also with this, we also look like there's a huge increase, right, of hotlines reported up 1,000% increase in texts and calls compared to 2019. There's a huge increase with online therapy now because of whatever they're currently going through. There's just increases in the mental health and the domestic violence and sexual assaults, human trafficking. These are all increased because of an unbalanced look and approach of our pandemic. These are the public health concerns that we're all having to go through right now, and it's a drastic effect. This could cause a huge increase in spike in suicides. And right now, we have over 200 deaths from suicide a year. 200 deaths in suicide. With this pandemic in place and people having to limit their contact with other people, that may double. That number may double to 300 to 400 deaths a year in suicides. Our COVID death right now is at 24 deaths from COVID. So we have to really look at how we can balance all of these as best as possible and how we can create a balanced approach to our pandemic. Human trafficking, as you guys have heard, is one of the biggest things that's going on right now. Over 2 million people across the entire world are trafficked, whether it's just sex trafficking, job trafficking, work trafficking, all of these things. And right now, this is happening even on our own particular island. There's 2 cases of it that happened on the Big Island just a few months ago. Precautionary measures for school. Again, the schools are taking steps to limit people visiting the schools. They're going to limit the group sizes to 10. They're going to stagger schedules, like I mentioned earlier, what's happening with my kids at school. And of course, they're going to do, every campus is going to have a certified nurse and a specific room and area where they can isolate a student or someone who could be possibly COVID positive and immediately. So they're taking as many precautions as they can. Like I mentioned earlier, is it perfect? Absolutely not. But it's at least a step in the right direction, and we can adjust as we go to improve on what we have. So currently right now, as far as our community is, we're currently in the act of with care in our road to reopening. And that's where we are. We're trying to focus on reopening slowly. We've opened quite a few things in our economy to help ease our anxieties, where now we can leave the house, we can have outdoor activities, we can go to gyms to work out. All, of course, helps increase and improve our self-care. So these are things that's helping us. We can dine out. We can go into dining in restaurants now, again, for social interactions, all with that caveat of me trying to be doing our best to maintain social distancing. So we're here right now. Many businesses are starting to slowly open as best as they can. Of course, it's not quite there because there's not enough of a population or the tourist population to be there to actually help push the economy along. But we're moving in the right direction. I mentioned earlier with my four-legged approach with the chair, this is kind of like how the Maui County currently looks at it as far as reopening, a balance with the public health, community, and economy, doing our best to safely open our economy, limiting the spread through that aspect, looking at our community with social distance and face coverings, and of course, protecting our kupuna and our most vulnerable people in our community, including our kids. So we talked a little bit about this, accommodations for teachers, having alternatives to teaching, which they've done online, face to face. And of course, which is one thing they've been asking for, is the remote access to work, which is what we call for online. One of the things I also want to suggest is that students that are coming from high-risk areas are really something that the schools and campuses need to really look at. For example, Micronesian homes is just an example where they come from a very dense population. A Micronesian home can have anywhere between 10 to 20 people living in the same area. And whether or not they're practicing social or safe distancing when they are out and about is a big factor. There's been big clusters of that on the Big Island, big clusters of that on Oahu right now for these really close-knit families with many, many people in the home. So knowing a student comes from that background is really critical and important. So having that conversation with our students as far as where they're from and who they live with is also really important to helping us addressing and understanding, oh, okay, this person may be more at a higher risk because of the area that they're coming from. Again, that's a conversation you guys can have with your particular students. The goal, of course, is to the recovery and hopefully one day to get to the new norm. And that new norm could, until we get herd immunity or until we can get a vaccine, currently right now is the social distancing, is the mask wearing, is the washing and hygiene. These are all our new norms. So we got to constantly address it and understand the direction that we're going and not become complacent where we go back to our old habits where we can put ourselves and our family and our friends at risk. Can we possibly go back? Yes, absolutely. As you guys already seen in the news, many states across the nation have gone back to staying at home. They've gone back to phase one basically, or they can't leave. They have to be back home. Businesses are shutting down and closing again. Unfortunately, as you guys may have seen across the nation, this was months ago when I saw it happening in Florida when they opened up the beaches and you saw thousands and thousands and thousands of people flock to the beaches all at once, all disregarding social distancing. And now these are some of the results of those inappropriate choices. Hopefully we as a community can maintain what we're doing. Like I said, State of Hawaii has done an excellent job, #1 in the entire nation, considering of what we've done to maintain our numbers as low as they are. So we as a community have to continue to do that. And if we can, our anxieties can be stabilized to a point where we don't have to worry so much, because knowing our numbers, knowing the effect of social distancing and PPE and the proper use of PPE can really help us with our decisions as far as how we move forward. This is the final road to recovery, right? We want to eventually get to ensuring resiliency. We want to get to a safer place. We want to have robust contact tracing, which the campus actually has a pretty good background and support in that. And we want to have a responsible economic restart. We want to be able to start slowly and effectively, but we have to move in that direction. And in order to do that, we have to maintain what we can control. Again, I keep saying it with the social distancing, the PPE, you know, things like that is extremely, really critical. So grief is a natural part of all of this, right? Because of all of this, there's so much issues that's going on. There's a change, a transition, loss, and of course, death. I have a few people who are close to me who have had friends, family in the mainland who have died because of COVID-19. One of my own soldiers right now, his mom is battling COVID-19 in Arizona. luckily, like she just told me today, that she's actually starting on the recovery end, so she's actually come out of the woods. She's doing much better, but it was questionable for a while there because she was 65, but she's made it out, luckily. You know, so these are things that we all are changing to. Grief is a normal process for us. We have to respond to how we're gonna address to these changes. But if we educate ourselves, if we know that we can protect ourselves, if we understand that we can protect ourselves, if we understand that everyone in our community is doing their part to protect themselves, we can move forward with a lesser amount of anxiety and a more stabilized amount of anxiety. The healing process. This is really important because we all will have to go through this process. The process this whole change in our culture and our way of life is really part of the healing process. We have to go through this. We all will have to grow in areas where to be more warm, more understanding, and have this wisdom and knowledge of the science behind all of this and how that all relates to each other and to ourselves. So with that being said, we can really help ourselves heal and not be so worried and afraid and anxious about moving forward as long as we're understanding our process. And the reality is, through this whole pandemic, we may never go back to the normal, quote unquote, normal way. We have a new norm, as we've been saying it time and time again. And so we have to address and mold with that new change. And however it is for you and your family, that'll be dependent on you, on how you adapt to that change. Part of the grief process, like we talked earlier, right, is for a lot of these people not having these basic things in their lives. Now that people are stuck at home, they're stuck in a relationship that's troubling or could be abusive, right? They're not able to get the proper help out there. A lot of people don't have enough food to last. We have numerous food drives all across our state, and in particular on Maui. So if you need to go to these food drives, please humble yourself and go if that's going to help your family out. This Saturday, at the beginning at Ani, they're going to be giving out food again, and boxes of food and plate lunches and rice. My team helps with that distribution, and there's so many different organizations in our community right now that's doing their best to give back to the community. So if you know someone, these are things that we can do to really help offer that support, because this is the part that gets complicated for us. Right? We grieve on these things, we struggle with these things because we find out we don't have the normal support system that we had in the past. But with the constant moving forward and reopening of our economy, hopefully these things will start to improve. I talked a little bit about this already. So these are things that I talked to Elect about, right? Things that we can control and things that can't be controlled. Right? We can control our hygiene. We can control our self-care. We can control our thoughts and actions, right? We can control about reaching out for help if we're in need of help, right? Things that you cannot control. You cannot control what's going on in the world and the spread. We can't control what other people do and what they don't do to take care of themselves. We can't always control the government's response and whether you think the president's doing a poor job or a great job. We don't control that. We don't control the statistics. We can't worry about, oh my God, we have 4 million cases in America. We can't be worried about those things because we can't control those things. We can't control how our Congress and everyone's gonna address in their various laws and regulations, right? But knowing that you yourself is doing everything you can really help bring you at peace with your anxiety. We can really help you know that, you know what, everything will fall in place the way it's supposed to, as long as I'm doing what I need to do for my family, for myself, for my friends, for my community, and we all take that approach. We can all come to gather and get to the right place in our society and move forward appropriately and correctly with a well-balanced approach with our healthcare, with our economics, with the public health concerns, and our politics. This is just a quick example of mental health and relieving anxiety, right? One of the things that we want to do when we talk about self-care is a really balanced approach. I talk about balance all the time because it's important. You want to maintain a healthy diet as best as that is. You want to have a regimented exercise program. You want to make sure you get enough sleep. take advantage right now. You're allowed to go outdoors. You can go on hikes. You can go to the beach. You can go and do outdoor activities. As long as you're practicing social distance, by all means, I highly encourage people to do that, right? Right now, because we're not closed and we're not at stay-at-home order, don't isolate yourself. Go out, meet friends that you haven't seen in a long time, and until you can determine if they've been isolating, you can do that and still have social distancing. You can do that through Zoom or virtual appointments. Just make sure you're reaching out to people. You're no longer isolating when there's no need to if you're not infected. You want to have a daily routine, whatever that is, as normalized as it is for you. Whether you have breakfast in the morning at a certain time, you have your coffee, whatever that routine is for you, that's part of helping yourself and your mental health and helping relieve your anxiety. And of course, what you don't want to do, what you should do actually, is do your best to take a break from all the news outlets out there that's always talking negative, and you hear it all the time about, oh, there's new cases and this and new cases of that. You want to have a healthy balance of that, not to live by it every single day and tracking the numbers daily, hourly. That's becoming more obsessive. Be sure that you understand the numbers. You understand it, but you're not becoming obsessive about it. So take a break from it sometimes. Go for a walk, enjoy the sun, enjoy the sand in your feet, enjoy a fresh smelling rose. Just do those things in your normal day that can really help relieve anxiety in itself. And we've talked about this before, right? We're helping our children regarding coronavirus anxiety. Most of our kids don't understand what's going on. All they know is that they can't go anywhere. They've been stuck at home, right? But before we can help them, we have to be able to manage ourselves. We have to be able to understand what's going on, have a very basic knowledge of the current disease, so we can do our best to educate our children. We want to be as honest as we can, but we don't want to show concern or scare them. We want to teach kids that they also have control of limiting the spread of this through their social distancing, whether it's through wearing of their face masks and teaching them proper hygiene as well, right? You want to reassure them that we as a community, as the adults, we're doing everything we can, that we're moving forward, that we're going to do everything to protect them, to protect ourselves, to protect our community. We want to always assure our kids that. And then, of course, we want to let our kids get out of the house. We want to let them go outside in the lawn and have fun and laugh and exercise and get that fresh air. Take them to the beach whenever you can, as long as it's not too overly crowded. Be outdoors with them. It will really help them a lot, as much as you can. So self-care. We already talked a lot about self-care, right? So these are the basic areas. You want to make sure you're emotionally taking care of yourself. You're physically taking care of it. We talked about exercising and mentally taking care of yourself. That you're not overly anxious or worried about your future, about your job, about your finances. These are things you really got to address and look at. Socially, don't isolate if there's no need to isolate. Enjoy your friends. Have that dine in where you go out and have a dinner with someone. Spiritually, whatever your spirituality base is, whether it's Christian or not, whatever that is, find that spirituality, that base, that faith, so you have that to lean on when times are rough. These are many of the things that you can do for yourself. Self-care is not something I can preach, because self-care is different for everyone, but you need to find something for yourself. How can you take care of yourself? That's when someone else can't do it for you, right? How can you emotionally take care of yourself? Sometimes we have to praise ourselves. We have to give ourselves props. We look at positive affirmation quotes and read them and believe in them, right? We have to look at things like that, so how we can lift our spirits up if there's no one else around. So these are things that you do for self-care. We talked a little bit about that already, about your routine and things like that, right? Eating healthy, physical activity. These are things that you can improve, that you have control over. It's up to you how it will impact your life, how it will impact your body, how it will impact the people around you, because you're taking care of yourself. The moment you're stuck in bed and you're isolating, and you limit your contact with people because of anxiousness, because of fear, that's when you're taking steps back. So we have to constantly do our best to move forward, knowing the facts, knowing the science behind things, knowing there's protocols and things in place that we have control over, can really help us in our self-care. right? We talked about gyms. We talked about being able to go out into gyms. I don't always recommend it, but if you do, if your gym has proper protocol in place where you can have your own space to work out and whatnot, by all means. If you don't do that, then go to the gyms and don't take off your mask. Keep your mask on. Lighten your load when you work out. So instead of benching 300 pounds, now you're going to bench 100, but you do slightly more reps of it. You can still get the same workout, but then you're lessening the amount of exertion that you're putting out there. So instead of having an hour workout, your workout might be now hour and a half or two, because you're doing things for a longer period of time, slower and less weight than before, but you're exerting yourself less, just over a longer period of time. So those are things you can do as far as physically, right? And of course, you want to take care of yourself. Always take care of yourself, your body, your mind, your health, your soul. Those are all aspects that you got to look at. And how you do it, I'm sure you guys all have great ideas on how you can do it. So by all means, whatever means that works for you. I'm not here to tell you whether they're right or wrong. As long as you're not abusing any kind of drugs or alcohol, then you're good. You're doing something legal, you're good. You're doing something illegal, maybe that's something you should really reconsider. So I've already talked a lot about this, right? Taking care of your body, taking care of your mind and your spirit, and staying connected to people socially, and how we can actually do that. So in conclusion, right? Anxiety in reality is actually really good because it keeps us on our toes. There's a fine level of anxiety that's really important because it can keep us kind of non-complacent with that anxiety, because we're going to be hopefully able to remind ourselves about social distancing, remind ourselves about washing our hands, remind ourselves about the new change in our society and our culture. With that, we can normalize our anxiety to a different level now. So it doesn't have to be so high. It can be dropped down now, knowing this is what our new movement in our culture will be, right? Allowing ourselves to grieve and understand that the changes in our lives are here. But those changes aren't necessarily something that can drastically affect or change our whole outlook on life. That we allow ourselves to grieve through the different changes that's going on, allow ourselves to accept the movement or the direction that we're going into because of the different changes, the transition, the loss that we go through COVID. And of course, which we talked about in length already, is practicing daily self-care. And by all means, please be kind to yourself. Don't beat yourself up because of you're not exercising enough. Don't beat yourself up because you're doing something wrong, right? Lift yourself up as much as as much as possible. Do your best to always be kind to yourself. All right? If you do the right thing and you follow the rules and you're a good person, you can't go wrong. Right? So continue to do that. And I think with that being said, that concludes my presentation. Right about an hour or so. So if there's any questions, comments, more open to hearing anything from whoever's left. If there's no questions, I want to thank you guys for being here in my presentation. And I want you guys to continue to be safe. Please, please, please do your part in our community, for yourselves, for your family, with practicing social distancing, proper use of PPE, and of course, educating yourself on the nearest trends and sciences and statistics, but not become too overly obsessive about it. Okay, any questions for me before we go? Okay, none heard. So thank you again, and you guys have a great day.